Good morning. We're live at 45 Urgent Care. My name is Lisa, and this is Elena. She is going to be giving me my stem cells today. This is what stem cells look like when they are thawed. You get a good close-up look on that. Right now, I have a saline drip. Nothing special about that going in my arm. As you can see, Elena is pre-medicating me with some Solumedrol, which is a steroid type medicine. The reason is because when they freeze these, they put DMSO in it, which has a sulfa chain, and I am allergic to sulfa, so we're pre-medicating me for that reason. DMSO is a very mild sulfa chain, so I don't expect to have any reaction to it, but we're doing it just for precautions. If you get stem cells and you're not allergic to sulfa, you would not need to go through that process of getting pre-medicated. But that's what we're doing right now. There's nothing special about the saline drip. It's just like any other drip you would get in the hospital if you were just there for IV fluids and not for anything else. It is consistent with the body fluids, so anybody can get a bag of saline. It just helps to hydrate them. One of the things that I did before I got here this morning was to hydrate myself. I usually have 2 cups of coffee. I did get up and get 1 cup of coffee, and that is because I have to have it to stay awake and get myself alert and oriented in the morning like most people do. But I stopped at 1 cup and I started drinking water. I've already drank 1.5 bottles of water before I got here to make sure my veins were pumped up and hydrated enough to receive an IV. As soon as these get thawed out, we are going to put them in a syringe, and she is going to administer them. You want to take these and thaw them? Thank you. So the reason I'm getting stem cells is because I have psoriasis, psoriatic arthritis, which is an autoimmune disorder. One of nature's most potent anti-inflammatories happens to be stem cells. The stem cells will, when they are inserted into my blood, my body will send out messages to them where inflammation is in my body, and it will help to decrease the inflammation in the body, and therefore help decrease the disease process that is going on in my body. Right now, I am taking very high-powered medicines to help control the psoriasis. I have a severe case. I've been hospitalized multiple times, have chronic pain, even when I am well controlled. As you see, I have a little bit on my skin right here on my elbows is what I have right now, and then occasionally I will have some chronic pain issues in my joints, about usually on the level of 2 or 3 out of 10. Nothing real major, but something that I usually have to take ibuprofen to go to sleep at night, and usually that's all that I have as long as I take my medication. When I don't take my medicine, it's severe. The skin breaks out pretty much head to toe in something called pustular psoriasis. It's a very rare form of psoriasis. Also, my joints will get very sore to the point where I can hardly walk. My hands have been swollen to the point where I couldn't open a bottle of water by myself because of the pain.